My name is Ngoma, and I'm the project manager for tobacco harm reduction Malawi. And the title of my presentation is the critical role of tobacco harm reduction in the critical role of tobacco harm reduction for health in low and middle income countries. The public health concept of harm reduction is not new. In African context, harm reduction programs, policies, and practices are implemented and applied in so many areas and sectors. For example, in HIV and AIDS prevention, those people who cannot manage to abstain or to remain faithful to one partner are encouraged to practice safe sex with condoms as harm reduction products. Similarly, at road traffic, people are encouraged to wear seatbelts and observe other road safety rules and regulations in order to reduce the risk of accidents. For nicotine consumers, there are innovative technologies that have been developed and proven to be delivering nicotine in a less harmful format as compared to smoking. However, tobacco harm reduction adoption and implementation in low and middle income countries continue to face multiple challenges. And here are some of those challenges. Many low and middle income countries are not sufficient to resource to implement tobacco harm reduction measures. The situation is further complicated in countries where the economy is reliant on tobacco production because there is a general mistaken belief that adopting unsmoking measures could result into economic hardships for such a country. The other challenge is that government policies and regulations are being unduly influenced by flawed science and anti-harm reduction lobbying, leading to sensational media coverage. Anti-harm reduction is flawed public health information in many countries is confusing and misleading those people who like to switch away from smoking. On top of that, some people have turned the war against smoking into a war against nicotine. By now, it should be well understood that people smoke for nicotine, but they end up being harmed by the hundreds of toxic chemical substances that are found in burning tobacco leaves. Besides, I'm one of those people who believe that the WHO wouldn't have recommended nicotine patches and nicotine gum if nicotine was posing the harms that anti-harm reductionists are propelling in their messages. So in most low and middle income countries, tobacco harm reduction products are either banned completely, like in Gambia and India, heavily taxed, like in Kenya, where if one wants to buy an electronic cigarette, which maybe costs about $45, they have to pay a fixed tax of $30. And if one has to buy a cartridge which costs about $5, they have to pay a fixed tax of about $20. And in other countries, there are no specific laws that govern tobacco harm reduction, like Tanzania and Malawi. The other challenge is that there is limited knowledge and access to tobacco harm reduction products among the local smoking population. For example, the 2018 country profile by the Foundation for a Smoke-Free World indicates that out of the 1 million daily adult smokers, only 8% of them are aware of electronic cigarettes. This means that those people who actually use the cigarettes could be even below the 8% figure. And in most low and middle income countries, tobacco harm reduction products are very expensive to buy. For example, in Malawi, you won't find nicotine pouches and snus, but the cheapest electronic cigarette that I've come across costs about $75, whereas the cheapest pack of regular cigarettes, that's combustible cigarettes, costs about less than half a dollar. Now, let us look at the critical role that tobacco harm reduction can play in upholding public health in low and middle income countries. Though some smokers wish to quit, they are unable to do so because they are addicted to nicotine, and the relapse rates are staggeringly high. Some smokers will plainly tell you in your face that they would rather die than quit. Let me share with you a real life experience. I had an opportunity to visit the medical ward at the Kamuzu Central Hospital, where those people who are suffering from smoking-related illnesses like lung cancer are hospitalized. I was shocked to learn from one of the nurses that some patients sneak out of the hospital just to get a smoke because there are no safer alternatives of satisfying their nicotine crave whilst in the hospital. So the primary strategies for reducing harm must be both encouraging cessation and capitalizing on harm reduction for those who are unable or unwilling to quit smoking. Finally, our request to the Ministry of Health in Malawi and other governments in low and middle income countries is that millions of people should not be denied of access to products that can help them avoid poor quality of life, diseases, and premature death. Preventing access to these products through bad policy denies people their right to health. So policy should encompass issues to do with access to credible information on science and making tobacco harm reduction products readily available and affordable for people who are living in low and middle income countries. Another humble request is that when you are formulating smoking related or related policies or tobacco harm reduction related policies, please ensure to incorporate views of nicotine consumers. As the saying goes, there is nothing about us without us. And our request to the Ministry of Trade and Industry in Malawi and other governments in low and middle income countries is that just like you facilitate ease access to affordable harm reduction products, please help in making tobacco harm reduction products easily accessible and affordable by the people who are struggling with the habit of smoking. Formulating favorable policies on tobacco harm reduction is likely to stimulate demand for safer nicotine products, making them much more available in low and middle income countries. Alternatively, governments in low and middle income countries can engage with investors and innovators operating on their soil to manufacture and retail low-tech tobacco harm reduction products like snus, which can be relatively cheaper for an average smoker who is living in low and middle income countries. That is the end of my presentation. Thank you very much for being a very nice audience.